All right, let's talk to a community health physician, Tolulope Kotey, who is an expert, of course, on health matters, on the significance and challenges associated with blood donation. Thank you very much indeed for coming.
Thank you.
Well, statistics show that about 112.5 million blood donations are collected globally. But do you think that this is enough to meet global demand?
Okay, thank you. The statistics has clearly showed that it's not enough to meet the global demand. Presently, the over 112,000 blood donations that you spoke about, it's mainly more than 50% of it is was donated in the high-income countries, and these are countries where just 19% of the population live. But when you come down to Africa, sub-Saharan Africa, that's where we really even need more blood, because we have a lot of burden. The under 5 burden is there, the malnutrition, even the women when they're pregnant, postpartum hemorrhage. Then it's needed for complex surgeries.
People in crisis situations as well.
Yes, and people in crisis situations. We have the insurgencies, a building collapse, road traffic accidents. So really, when we actually look at it in terms of Africa, we are nowhere near.
We need more.
We need more. More can still be done.
All right. So, well, this year's slogan is "Give blood, give now, give often." How can we begin to sensitize the public? Let the people know that, look, it is very important for you to give it, give now, and often.
Okay. The theme for this year, what it tried to do is it highlighted the role of every individual that we have to play, especially in emergency situations. We do not even have to wait for these emergency situations to happen before we donate blood. So it's something, it should not be a one-off thing, just donating and we go. It should be a regular occurrence. And if we do this, we can build the stock level of the blood. So even when the emergencies occur.
So it has to be voluntary?
Yes, it has to be voluntary. And in order to improve public awareness for the voluntary blood donation, it's recommended that the blood donation should be voluntary and non-remunerated, because these people have been shown it's a sustainable way to have optimal blood levels. But what can we do? Increase the public awareness, distribution of information, education, and communication materials. Then we could actually partner with schools. We could partner with young people too. Young people can actually donate blood, and these are shown there has been it's been sustainable in some areas. It's been tried out in some areas. We could partner with faith-based organizations, involve the community. The community, if we have their buy-in, it will go a long way, because don't forget that even concerning donating blood in Africa generally, we still have beliefs and attitudes which could actually be improved on by education. So if we have full community participation, we'll have at least we'll be able to reach more people and give them the correct information, thereby encouraging other people to donate blood, and this will be sustainable.
All right. Now, as this happens, you understand there are challenges as well that go along. For instance, in one of the, the last report that we just played, you heard some respondents, particularly one of them who said, look, I haven't even, had enough food. So how do I, donate, blood, and all that, because you need supplements to replenish the system, So those are some of the challenges you're going to have. So how can we, eliminate, these challenges to ensure that people give blood, give often, and so forth?
Yeah. Yes, it still boils down to education. If they have the right information and misconceptions and the myths are disregarded, I think more people will be encouraged to give blood. If they know that it doesn't take much to give blood, so far you've been screened and there is no other no other diseases that would prevent a person from being a blood donor. Eating, living right, healthy living, good nutrition, exercise, then you are fine to donate blood. So it doesn't take much to donate blood.
All right, and community health physician Tolulope Kotey, well, thank you very much indeed for coming to talk to us.
Thank you very much.
All right.